Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today I am excited to have Aly DePaschalis as my guest. Aly is a territory manager for Align Technology, the makers of Invisalign and iTero intraoral scanners, focusing on GP practices in the East Bay of Northern California. This is her 6th year with Align, but she has over 20 years in the dental field, the majority in restorative dentistry, beginning with 3M. Aly is an educator who is passionate about elevating dental providers and the dental industry as a whole, and is excited about watching the technology transformation of dentistry. Therefore, she's got her teeth in the background there. Uh, she is also the proud mother of a 12-year-old son, Luke, who up until a few years ago actually thought she was a dentist. So welcome to the podcast, Aly.
Thank you. I'm glad to be here.
Yeah, awesome. Awesome. So there's probably a lot of different things we could talk about from all of those years in that you've been in the world of dentistry, but we've kind of keyed in on a few areas because of that, the technology world that you're in. So maybe that's a good place to start. Maybe
Great.
your thoughts on how dentistry has changed with the introduction of digital, maybe as a first place.
Sure. Yes, I have definitely seen it change significantly over the years. When I first started in 2003, didn't know anything about dentistry and kind of just went to the dentist and whatever the dentist said that you needed, you just agreed on and you did it. And, it used to be where they would take pictures and then they'd have film x-rays. And,
Right.
when I first got into the field, that was kind of the beginning of that transformation. Digital x-ray was coming out and it was a
Mhm.
super cool thing to see in offices, but it wasn't everywhere.
Right.
And now you would expect to go into an office and that would not even be something you thought of because it's such a standard of care now. So, and that was the beginning. And I was with 3M at the time. I remember their biggest product sales was impression material. And as a newbie, I was fortunate to get to be part of a marketing when at the launch of their product called Lava. And that was the big discussion is we really have to start thinking about, getting into digital scanners for digital impressioning. And so that was over 20 years ago, and it's evolved significantly. And there's so many intraoral scanners out there now. It's really neat to see. So,
So how would you say that has improved things from a patient perspective? When you think about the benefits to the patients of this shift, what would you say?
well, we're all digital consumers, right? Most people have smartphones now, and they're not just using their cell phone for a phone call. They're actually utilizing, looking up stuff on the internet, Googling this, Googling that. So, from great grandmas down to kids, everybody's very digitally aware. And so, with that, when you're in the dentist, when I was a kid, like I said, you would just say, okay, whatever you say, let's do it. Now, with all of the technology, the intraoral scanners, the intraoral camera, x-ray, digital x-rays, you're able to show the patient what's really going on so that they're able to understand why they need treatment and how important that is, but also trust, have that built that trust with
Mhm.
their dental provider and make the right decisions for their health, as far as their health.
And then from a the professional standpoint, for those that are watching us that so I've been thinking about some new technology. I'm thinking about uh, moving more into a scanner direction and that sort of thing, but I haven't yet. What would you say? Um, what would you say is to the benefits for them, and what do they need to know so that they could say maybe I do want to pull the trigger on this, and this is what I could expect as a result?
Oh, okay. So when you're looking into technology, obviously you want to research what's out there, right? What are kind of the top five, that in the industry, and there's several publications you can go to. You can also ask your friends. There's a lot of groups out there like WhatsApp groups, chat groups, dental groups, and really try to understand what are you going to be using this for? What's important to your practice?
Hmm.
And we have the iTero, as you mentioned, and
Hmm.
uh, I have been fortunate in that I get to work with it. And, a lot of people think it's the Invisalign scanner. Well, it actually isn't. Um, Cadent was we bought Cadent. So Align bought Cadent, who was the maker of iTero in 2011. And the reason we bought a scanner company is because we have to be able to have control in order to make the aligners so that they work exactly how they should. And so when you're thinking of, for us, it's really the educational platform. It's a great product,
Hmm.
but are you using it for that, or are you using it just as an impression material replacement? What are your focus as far as looking for it in an oral scan?
Right.
Because if it's price and there's that too, so there's a lot of options out there available, but they all pretty much are going to do what you need them to do, and that's replace impression material. And so those that have any educational platforms, I would think it's probably the most um, like needed in the industry to be able to share again what you're seeing so the patient understands it. So
Okay, good. What do you see as things being done wrong or suboptimally maybe for providers, is whether it's in um, maybe not knowing fully what the possibilities are or how to best. I mean, because digital technology, any technology, doesn't do everything for us. It doesn't answer everything, right? So where do you see uh, potential disconnects between what the patient needs and the technology and where it goes from there? Yeah, maybe where is the whole opportunity for either the things that you personally are doing, but also just with technology in the office in general, where is having it not necessarily leading to the best outcomes? What's being missed there?
gotcha. So, obviously having the technology and if you're paying for the technology, you want to make the most use out of that, right?
Hmm.
And so, where I think the miss is, if I'm even looking at our own iTero,
Hmm.
for instance, is instead of really looking at as an educational tool
Hmm.
and you have all these tools on it, but you're not actually using those tools, or you're not taking the time to do proactive scanning so that you can monitor what's going on with the patient's oral health. And some practices will just take a scan and then they won't talk about it.
Hmm.
And so that's a miss. It really is. It's an opportunity for the doctor to really communicate at a level that their patient can understand. Even in the dental world, there's things that we don't all know as people, right? That a dentist knows. But I can guarantee you, if you're not in the dental world, you don't understand 100% of what's actually going on in that what a doctor sees, right? So when a doctor looks at an X-ray, they know what they're looking for, but a patient doesn't really understand it.
Right.
So I think that would be a huge miss and a great opportunity for doctors is to be able to utilize their technology to educate.
Yeah, that's good. I was kind of hoping you might go in a direction like that because, and in my work with People Plus Purpose in communication, it's styles, strengths of individuals, and how do we bring those strengths together as a team, and how important communication is amongst the team members, but also towards the patient from every team member.
Mhm.
And so that's one thing that I personally have experienced, is that a lot of investment in technology, and I think dentists really enjoy technology,
Mhm.
but haven't always had the training, or maybe those aren't their greatest strengths in terms of communication.
Mhm.
Therefore, the educational opportunity there, I think, can fall short sometimes. So does that all make sense for you?
Absolutely, absolutely. And I watch all these young dentists come and they're all trained in, scanning technologies. And really, it's exciting to see where the technology is going and what they're walking into compared to back in the day, when there wasn't any technology. And so it is exciting. It's shocking to see the change, but it'll be interesting even in the next few years, with AI being such a huge
Right.
part of technology in general. The data that we're able to capture is amazing, but even with AI, it's missing the human principle of it, right? And that's you could have all the data, but if you're not, taking that data and communicating with your patient, then it's really not, it doesn't do any good for you. So excited to see where the industry is going to continue to grow from here.
Yeah. Yeah. Because we're not really necessarily wanting to go in, have it be technology, but delivered purely by robots, right?
Right.
We
Exactly.
still are actually drawn to human beings who bring certain qualities that will never be replaced, from my perspective, by AI or anything else. But so maybe
Yep.
a good segue there is, how is any of this influencing what the dental consumer is expecting? What are they looking for? What's going to make the best experience for them?
So I really think that, especially right now with, intraoral scanners are kind of that latest. I mean, when I say latest, it's when you think of the S curve, we're at that tipping point. It's everybody in the next few years is going to have them. So it's cool when you walk into an office and you get a scan and you're able to see, wow, you don't see your oral uh, um, area like that you're able to when it's up on that big screen. And so consumers are expecting modern, clean technology, the education, the communication, and services, having those, different types of services available to them, because it's, they expect to go to the dentist and get a cleaning and find out if there's any crowns or cavities or whatever. But, you know, these offices, that there's so much more to offer than just that. Even, whitening, for instance, how
Right.
many people wouldn't want to whiten their teeth? And there other opportunities as well. And so I think that's really what the consumer's looking for. They're also looking, not just, there's no yellow pages. I mean, there is, but most of us don't use them.
Right.
But when they're going to Google for a dentist nearby, they want to see, what does it look like? What does the office look like? How, and so there's some great websites. They're also looking on Instagram and Facebook and different social media avenues for offices to be on there, because that's how my offices that are growing are able to grow, is they're able to capture consumers outside of just the general area, because consumers are looking for that specific type of office. So definitely, if you're not into technology yet and you plan to be here for the next 10 years, it's definitely a good time to look for a few things in the GP practice. One, obviously, intraoral scanners, but CBCT, and also 3D printing, 3D printers. And that's really where everything's going. And so it's come a long way, and it's not gonna stop anytime soon. So
Right. How does any of that fit, or anything else that comes to mind relative to uh, the economy, right?
mhm.
Which, some practices, I hear them say that are inclined to think that, well, people are not wanting to invest any more than they have to in dental care or services in general. But I also think, as more are deciding to get out of network insurance, more people are looking to compete for, in a way other than just being on a list and maybe being most accessible and least expensive, right?
Mhm.
Competing on cheaper versus on being amazing.
Yeah.
So from you interact with a lot of different practices. So what's your sense as to things where some of the best practices that you're interacting with, what are they doing from a services perspective, to be able to compete on amazing, to be able to thrive maybe in any economy?
Absolutely. And again, it all stems from education. It's human nature to want to understand our health, right? In order to make those better decisions and being able to have options. There's even down to saliva testing. They're, offering that so that a patient understands why some of these things are happening. And that's a service, believe it or not. It's not something that insurance pays for, but when you explain to a patient, this test is going to help you and us understand what we can do and where we can go to help you maintain your health we'd like to see you less dentistry is the best dentistry is the way that many even proactive doctors are, but also the education and sharing, these are the things that are going on, that if we don't do anything, this is going to continue to get worse. So having the ability to be proactive rather than reactive as a patient, because you have that option. If you're offering treatment and the patient decides that I'm not going to do it right now, that doesn't mean you stop offering treatment. But having beneficial services, cosmetic, believe it or not, in a down economy, so they say, is actually going to be 25% of the revenue. All revenue in 2024 is considered cosmetic dentistry. And now we have the ability. Align also owns exocad, and so which is the #1 lab software in the world, which is fantastic because we're able to do digital mock-ups to show patients, hey, this is what you could look like should you decide to go into, for instance, Invisalign or Invisalign plus restorative, and so they're able to see what they're going to, and with that visceral feeling of, wow, that could change my life. Yeah. Instead of having to go, well, I don't know, I'm not sure what that looks like, or try to show with another patient's picture, well, this is what this person did. It's really you. That's you talking and laughing and with your new smile. And, patients will pay for what they want. That's a consumer mentality, and they will find ways. But, it's important to show them and to be able to offer those services behind that. And so, I think that, and, also with the consumer, making sure you have financing available that, and it's a lot of doctors will say, well, we have care credit. Absolutely. That's one option, but there are other options out there as well that might be more beneficial or easier to get financing. And so if you're able to do those, you're removing that barrier really for the patient. And now they're able to do the things that they need and want with their dental practice. So I think that's my best doctors are really implementing those things.
That's great. That's great. Yeah, I see a lot of, and not just in dentistry, but in other businesses as well, that there's a lot of assumptions made as far as what people will want and buy. And I think there's an aversion to the concept of selling on the part of many people, whether that's somebody at a front desk or the doctor themselves. And I like to kind of reframe that as ethical influence, because there's so many people that don't like the idea of, I don't want to sell. I don't want to feel like I'm pushing anything, but I'll say, you are the expert authority, right? They don't know you. They don't know what you know.
Exactly.
And you don't know what they will value. And I've at times tried to buy in my past with that people don't have time or money, and that may be true in a small fraction of situations, but I live here in San Diego. If I want to go out to dinner with my wife, I better get way out ahead of that from a timing perspective. Many of the best restaurants, I couldn't get in for 2 weeks or 3 weeks. So is it a down economy, or are people just investing in the experiences or in the things that matter, therefore even cosmetic, right? Because that leads to different experiences. So it just made me think of some of that when you were talking there, that we shouldn't second guess. We provide opportunity.
Mhm.
We expect that many people will want these things if we lead positively into it. So I appreciate all that
Absolutely.
you said there.
Well, and you said it exactly. It can, it's not selling if you're showing and you're educating. And um I always explain to my doctors, I'm like, hey, Allie, me, if you could have your dream smile, what would that be? And I would say Julia Roberts, but and my doctor would either know or not know, but know why. And it's that beautiful buccal corridor that she has, that wide gorgeous smile. And and so, you know what, Allie, what I'm gonna do for you is, if you'll come next week when you come in for your XYZ appointment, if you have 15 extra minutes, I'd love to show you what you could look like with that smile that is your dream smile. And the patient might ask, well, how much is that going to cost me? You know what? It's free. It's free. I just want to show you, if you're interested in ever doing some sort of procedures or treatment,
Mhm.
that what you would look like
Yeah.
after.
Yeah.
And so, and it, you think of like, is it Warbly, the eyeglasses? You
Oh,
can try on your eyeglasses at Sephora. You can try on the makeup by taking a selfie.
right,
We
right,
even have a smile view where you can take a selfie and look at your new smile. And so it's just, it's what it's, you can do whatever is imaginable. And we don't know, like you said, what is a patient interested in?
right.
They might say, I don't want to do Invisalign. Well, they're thinking Invisalign for cosmetic. Maybe they're not understanding clear aligners
Right.
for a tooth health, right? And so it just all comes back. When you're educating, you're not selling. And I don't like to sell either, and I'm considered a sales rep.
Right, right,
But for me, it's a passion of mine to
right.
teach,
Yeah,
and and help these offices to not only grow their Invisalign, right, but their bottom line, beyond just Invisalign, kind of,
right.
help them to understand there's the economy that they're thinking, because they're in an office, compared to what I'm seeing outside of their office, and how can I help you as your own business practice to grow. And so, I never come in going, you need to buy this most expensive piece of equipment. I try to find out, well, what is it that you need,
Right,
and we have options.
right.
And that's the coolest thing, is it's not an Invisalign, everyone. It's not an Invisalign scanner. It is a restorative and ortho scanner and patient educator.
Yeah,
So, those are things that you want to look into, in technology. Make sure that you're getting the most out of it. So, yeah, exciting to see how this next half of the year goes. And yeah, and thank you for having me today. I really appreciate it, and having the opportunity to share.
yeah.
Um,
Yeah, I
so,
appreciate your time and your input and your enthusiasm for all of the elements of dental contributions. So good for you. So for those people who say this was great, I would love to know more. Uh, how would you suggest people learn more or connect with you?
So with so I have my own territory in Northern California. If the doctor is an Invisalign provider, then they have a territory manager as well,
Mhm.
and they would either know them because they do Invisalign, or even if you got Invisalign certified, but you haven't necessarily done any cases. Um, you can go into your doctor site, and under the support tab, there on the right hand side, you'll see who your representative is, and they can come in and talk with you about it. About Invisalign, as well as what's out there now, because it's changed so much in the last 25 years, and it's gotten a lot easier to do. So, and then as far as our iTero, you can also go on to iTero.com, and there's solutions, there's ROI calculators. So it really kind of breaks it down. So if you want to do your research before, you could do that and then reach out to your representative. But we're very well trained here in the sense of understanding how to utilize these tools and verbiage behind it. And, what we're not, we don't sell Invisalign. We're consultants.
Mhm.
And so I can't sell you an Invisalign. And so it's really important for me and my doctor practices is that we are, what's the workflow from front to back?
Mhm.
What's the experience? What's the patient experience? And so that's where my office is. I'm able to help them grow. And I know we have some amazing representatives out there. It's Align really does do a great job at training all of us to be consultants. So, yeah.
That's great. Well, thank you, Aly. I so appreciate your time today.
Thank you. And I appreciate your time and what you do here. I love it. So, have a great weekend and we'll talk soon.
Thank you. So
Okay.
this is Dr. Matthew Norton. This is the Truth Behind Dentistry podcast. I've been with Aly DePaschalis, territory manager for Align Technology, and we look forward to seeing you on the next episode. And please do subscribe. That will make a big difference in terms of continuing to have great guests like Aly and reach even more people with the truth behind dentistry. So thank you.